How do molecular markers personalize bladder medicine? Imagine a world where your treatment is tailored specifically to your unique tumor profile. That's what molecular markers are making possible in bladder cancer care. These markers are tiny pieces of genetic and molecular information that reveal the specific characteristics of a patient's bladder tumor. By analyzing these details, doctors can better understand how the cancer behaves, how aggressive it might be, and which treatments are most likely to work for each individual. One key way molecular markers personalize treatment is by identifying genetic changes in the tumor. For example, mutations in genes like FGFR3 are common in certain bladder cancers. If a tumor has an FGFR3 mutation, targeted drugs that inhibit this gene can be used, offering a more precise approach than traditional treatments. Other markers, such as mutations in TP53 or amplifications in ERB2, also help predict how the tumor might respond and what the prognosis could be. Molecular markers also help predict how well a patient might respond to specific therapies. For instance, the overall number of mutations in a tumor, known as tumor mutational burden, can indicate whether immunotherapy drugs that target PID1 or PID-L1 pathways are likely to be effective. Patients with higher mutational burdens tend to respond better to these immune-based treatments, allowing doctors to choose therapies that are more likely to succeed. Another important aspect is risk assessment. By analyzing the molecular profile of a bladder tumor, doctors can classify the cancer into subgroups that have different risks of progression or recurrence. This helps determine how closely a patient should be monitored and how aggressive their treatment should be, leading to more personalized and effective management. Advances in liquid biopsies are also changing the game. These tests detect tumor DNA fragments in urine or blood, providing a non-invasive way to monitor disease. They can identify signs of residual disease or early recurrence before symptoms appear, giving patients and doctors a chance to act quickly with personalized adjustments to treatment. While many molecular markers have shown promise, only a few are currently approved for routine clinical use. Challenges include variability in marker expression and the complexity of tumor biology. Ongoing research is focused on combining data from genomics, transcriptomics, and proteomics, and using machine learning to discover new markers and improve their clinical utility. Some molecular tests, like BTA-STAT and NMP22, are already FDA approved to help diagnose and monitor bladder cancer. Emerging markers such as soluble Fas and fibronectin are being studied for their potential to further refine personalized care. The expression of proteins like EGFR and PDGFR may also guide combination therapies in the future, illustrating how molecular markers can shape tailored treatment plans. In summary, molecular markers are transforming bladder cancer medicine by providing detailed insights into each patient's tumor. They help guide diagnosis, predict outcomes, and personalize treatment options, all with the goal of improving results and reducing unnecessary treatments. As research continues, these markers will become even more integrated into everyday care, emphasizing the importance of consulting healthcare professionals for personalized advice based on your unique situation.